Infectious diseases expert Professor Sharon Lewin from the Doherty Institute is heading sequencing efforts over the Delta spread, and she joins us now in Melbourne. Professor, always good to talk to you. Are you any closer to finding out where this variant came from?
Morning, Ali. Great to speak to you too. At the moment, there's no additional information about where the variant came from. We look really hard to see whether the genetic barcode of this variant has a match with any of the genetic barcodes that have been identified in quarantine right across the country, and so far, no match.
So does that then suggest perhaps this hasn't come from hotel quarantine? Could it be from, say, a traveller who got an exemption to come back to the country?
I think that would be really, really unlikely. Those exemptions are rare. And it's important to know that of every positive case identified in quarantine, all around the country there are efforts to identify the barcode, but it's only possible in 80% of the positive cases, which means that for 20% we don't have that barcode, largely because of technical reasons. There's just not enough virus there, or you're unable to, the actual reaction doesn't work. So for 20% of cases, we don't have the barcode. I still think the most likely link is through hotel quarantine.
And how worried do we need to be about this new Delta variant? We were hearing, things about it being far more infectious than any other. Do we know how effective Pfizer and AstraZeneca are against this new variant?
So there are two Indian variants. There's the variants that were initially described in India, the Kappa variant, which is the main strain that we're seeing here in Melbourne, and then this smaller cluster now of 10 of the Delta variant. Both of them are around 50% more infectious than what we call the Alpha variant or the UK variant, but the same measures work, meaning masks, physical isolation, test, trace, isolate, all those measures will work. Now, the vaccines, we know actually much more about this smaller cluster, the Delta variant, than the Kappa variant and the effect of vaccines, because a lot of work's been done on this in the UK, where the Delta variant is the main variant circulating. And after the second dose of both vaccines, there certainly is protection, 80% reduction in infections if you've had 2 doses of the Pfizer vaccine, and 60% reduction if you've had 2 doses of the AstraZeneca vaccine. And there's probably even a better effect on preventing people getting sick and going to hospital. We just don't have those numbers.
OK, so we shouldn't be too overly concerned about this particular variant?
No, I think we need to be calm, use the same measures that we've been using for the other variants. Of course, this creates a lot of work for our contact tracers, because being more infectious means that there's going to be more people infected from every positive person. But we use the same measures, test, trace, isolate, mask wearing, and vaccinate as soon as you can, because vaccination really does make a difference.
Melbourne is due to come out of lockdown midnight Thursday. Should it, in your mind?
Look, in the end, it will be a decision for the authorities, but the signs are good. We're not identifying new chains of transmission. Most of the new infections that have been identified over the weekend were related to people that are already in quarantine or had a connection with where a positive case had been. So I'm pretty optimistic, but we'll see what happens over this week.
And Sharon, all pandemics, they end eventually. How much longer do you think this one has to run?
Well, I don't think we'll ever get rid of COVID-19. I think it's here to stay. There's just so much infection around the world with it. But what we want to do is convert it from a common cold, convert it from something that makes you really sick to a common cold. So I think the only way we can do that is by high vaccination rates, not just in Australia, but across the world. So we've had some really good news over the weekend from the G7 meeting, with commitment by those leaders to make sure everyone around the world can be vaccinated, I think with their goal of end of 2022. So I think vaccination is really the only way out of this at the moment. But we will be living with COVID-19, I think, for many, many years.
OK, not exactly what we want to hear, but fair enough, Sharon. Always good to talk to you.
I wish I could tell you something else, but that's the reality. But, we'll be countries that have got high vaccination rates are doing really well. Life will get back to something that we know as normal. I'm very confident of that.
Yeah, we've just got to lift that vaccination rate. Always good to talk to you. Thank you, Professor. Carl.
She delivers
Thanks
the
a lot.
bad news with a smile, at least. Well, the impact of Melbourne's COVID outbreak is being felt across all of Victoria. Even if lockdown is lifted this week, snowfields will be off limits this long weekend in what is a crushing blow to alpine businesses. Among them, Mount Buller business owners Caroline Frey and Dan Rogers, who join us now. Good morning, guys. Thank you for your time this morning. Really appreciate it. How bad is this for business?
Well, yeah, it's pretty bad. Like we've done this before, so we're hoping we can do it again. But you know, most of our clientele, majority are from Melbourne, and then international guests. So it's a real tough battle for us. But we're trying to stay positive and get through it.
Give us a sense of what the numbers difference is on previous years.
Oh, massive.
Yeah, substantial. It depends really which business we're looking into. Our snowplay tours are probably down by 50 to 50%, 70%, just from obviously international guests which aren't travelling, as well as that our gym is obviously still for closure at this current moment. So that's
0%.
0% right now. So we're hoping that the lockdown will obviously ease and hopefully we can get back to a certain sense of reality.
How do you survive?
I've got her.
Yeah.
So hopefully we can get married this season, fingers crossed. But but the plan is, to get married up here this season. But yeah, in terms of how do we survive, we just remain positive. Yeah, like I said, we've done it once before. We can do it again. I think the biggest lesson Mum ever taught me was it's not what happens, it's how you handle it. Yeah. So it's really just trying to stick together. We're a very small, tight-knit community up here.
Yep.
So wherever we can, we're getting the support from the government, which is great. So we just need that to continue. And when we can open up, we just need as many people up here as we can.
The federal government's promising, a $15,000 grant. Does that even touch the sides for you guys?
It's a great start.
Yeah.
It's been a really hard 2 years. So even before COVID, we had bushfires. So you have to factor that in as well. But it's really good to see the government continuing to support us because we need all the help we can get.
This one's been really hard, hasn't it? For some reason, and because I'm not down there and living through it, but everyone I've spoken to, Neil Mitchell included, over the weekend, I think everyone's found this one particularly hard. Maybe it was the freedom beforehand or what, I'm not sure. But for you guys, how would you rate it?
I think that everyone was extremely optimistic at the start.
Yeah.
We had a really great enthusiasm for this whole entire season. You saw, staff coming up here with a great smile on their face, hoping that this will be a better season. And obviously this brings a bit of a scares to some of those people. Obviously, we need to do what we need to do in order to beat this COVID. But hopefully, if restrictions ease, we can all get back to it. And obviously with people's support, local support, and everyone just coming up to also, see Mount Buller, it would definitely help us.
But this has just been another kick to the guts. Like we already know other businesses that have staff just going, nah, I'm out. I'm not doing this again. And they've gone back to Buller. So it's already been hard enough over the last, 4 months to try and recruit staff to come up here because they don't want to leave, where they're living, leave their jobs and then come up here and then get locked down again. So it's already been a battle. So, and then to have this happen again, we just want to get back to normality as soon as we can.
We wish you all the very best in that. And you mentioned that you're hoping to get married. Dan, have you asked Caroline yet, or is this just some sort of hopeful dream?
Yes, no, he has been. It's been going on for 2 years, 3 years. Obviously, we were supposed to get married last year, but that didn't happen. So we're hoping for the best for this year.
I mean, you better be quick, mate. You're punching well above your weight.
I know. I tell a lot of people that myself.
Same.
If you're open to it, we've actually got a lot of guests that can't come from overseas. So if you want to come down, there's actually a few seats available.
I'm happy to MC. Thank you, guys. Thank you, guys. All the very best. I know you're working so hard, and we wish you all the best in the coming weeks.
Thanks so much.
Congratulations too. Talk soon. Ali.